150 new cases of measles across the country has the CDC alarmed.
We are likely to see more cases. They're preventable. They're preventable by vaccine, and for places that haven't vaccinated, there's aggressive public health action to identify contacts, to isolate sick people, to quarantine people who've been exposed. But the best way to prevent measles is with vaccination.
But it is the reluctance by some parents to get their children vaccinated that the CDC believes caused this outbreak.
We do not need that many vaccines.
Former View host Jenny McCarthy believes that the measles, mumps, and rubella vaccination, or MMR, caused her son's autism. Her fears were rooted in a 1998 study published in The Lancet that linked the MMR vaccine to autism. That study has since been discredited, but the fear remains and has become an issue in the 2016 presidential campaign.
I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines. I'm not arguing vaccines are a bad idea. I think they're a good thing. But I think the parents should have some input. The state doesn't own your children. Parents own the children, and it is an issue of freedom.
New Jersey Governor Chris Christie recently agreed that parents should not be forced to vaccinate, setting up a debate between the rights of parents versus the public good, and a debate between leading Republicans and the White House.
There is every reason to get vaccinated. There aren't reasons to not.
To talk more about vaccinations and the current outbreak of measles is Dr. Robert Morgan, who is the chairman of the Children and Family Health Institute, Visiting Nurses Association Health Group. Also joining us is Dr. Herb Conaway, who is a state assemblyman in Burlington County. Let's start the discussion where everything started in 1998 with a study that came out linking autism to vaccinations. What's happened since then?
Well, that original study by Dr. Wakefield of London, England, has been totally discredited. It's been removed by the British Medical Journal, and they've disassociated themselves from it, as of all of his co-authors. It was not done in any scientifically established pattern. It was a very small sample size. I believe it was 7 children. 12 looked like that, yeah. Yes. And Dr. Wakefield was not an epidemiologist. He was not a medical scientist as such. He was an adult gastroenterologist. And he just gathered some information on this handful of children, put it out there, and because there was newness to the vaccine at that time, I believe the vaccine first came out in the mid-60s, probably, Herb, right?
Yeah. Well, this study came along
69.
well after it first came out. But this guy is a huckster, and he is no longer have a license to practice medicine in England because of what he has done.
But Assemblyman, don't you think it's important to start with him? Because that's where this all came from.
Yeah, well, and it was caused a disaster in terms of promulgating policy on immunizations, not only in this country but across the world, and we have not gained the ground that we should have gained on a lot of these scourges of mankind, and indeed we've lost ground because many people citing that study have decided that vaccines are unsafe, something which is absolutely untrue. Vaccines are safe. They've been proven to be so over and over and again, and the policy for people involved in public health, involved in government, should be to say, with one voice, vaccines are safe, and if you want to protect yourself and your children and community from the scourges of mankind like measles and smallpox and polio, you need to get vaccinated.
Has this become more of a political issue than a science issue?
Well, it should be a science issue and a science issue only. Vaccines are not political. The policy is driven by science. It's driven by a desire of health professionals, public health officials, to rid us, the humankind, of diseases. Vaccine preventable diseases do exactly that. They prevent diseases that are caused by viruses. And it is these protocols come about as a result of years of study on the vaccine itself and years of study on how the vaccine and when the vaccine should be delivered. The science is incontrovertible, and those in responsible positions, those who can speak, who have an opportunity to guide public policy, should follow the science. It should not be that you ignore the science and say sort of whatever you want that misleads people and which hurts the very important efforts in improving and enhancing and promoting public health.
If I have a religious reason for trying to get out of taking the vaccine, I can use that, but I don't have to prove it. You want to change that?
Yeah, the religious exemption, if you will, ought to be a bona fide one. Right now, under the regulation that the Christie administration passed, you can basically sort of write a statement that mentions the word religion or religious in it, and you are out of the vaccine program. And I think that kind of regulation is broad. It's beyond what the legislature intended when putting vaccine policy in New Jersey, bring it here in New Jersey in the first place. It leaves far too many people unvaccinated, and that leaves a risk not only to them as individuals, but as I've already stated, a risk to the larger community that we ought to avoid. And governments have a responsibility here to promote the public health, and vaccine policy is an important part of that effort.
Two questions to you, Dr. Morgan. Do you agree with that it should be required that everybody get a vaccine unless there is some health or religious exemption that can be proven?
Just a modifier on that. I mean, largely, yes, I do agree, but I think the reality is that we need to use those touch points that we have available to make it happen. I don't think you can, across the board, require everybody to do it, but for access to any public setting for those children, daycare, school, play group, reading circle in the library type of thing, yes. When you're going to put your child in contact with other children, you have a responsibility to make sure your child's vaccinated. If you don't want to do that, we live in the most densely populated state in the nation. We have more children per capita in New Jersey than any other state. If you really are adamant about not vaccinating your child, okay, but you know what? You need to get out of New Jersey. You need to move to Montana or something.
And one last question to both of you. Let's just leave that. one last question to both of you, only because there will be parents that are watching this program that are going through this decision. Is it more dangerous for their child to not be vaccinated than vaccinated?
Yes, to not be vaccinated, most certainly.
Absolutely. Most
certainly. And measles is not a benign condition. You can get pneumonia from it, you can get encephalitis from it. It is a serious condition that caused not only a lot of illness, but a number of deaths, all of which preventable by taking the vaccination. And indeed, not too long ago, the health officials declared that we were measles-free here in the United States. We have gotten rid of polio and smallpox. Vaccines work, they've been proven to work, and everyone who can be vaccinated should be vaccinated.
Not too long ago, we had over 1 million deaths a year around the world from measles, mostly in children under a year of age, okay? We've worked tremendously to bring that down because of mass vaccination efforts around the world. But also, Herb and I are of a generation where we remember when measles was around before the vaccines or was widely uptaken. And it's interesting, the only known cause of autism that we actually have, that we know about, is measles disease. Measles disease would leave a certain number of their victims in an autistic, moribund state. It's called subacute sclerosing panencephalitis. So
not getting the vaccine can actually cause autism.
You know, it's just interesting how the folks out there who are trying to make their scientific argument have the history is out there, you know.
Yeah, well, we have to wrap it up, but we'd love to have you back to talk more about autism, the causes of autism, and we didn't even get a chance to talk about what's really behind this push, but I'll leave that as a tease for the next time you both come back.
I'm not of his generation, just
much younger. Dr. Robert Morgan, the chairman of the Children and Family Health Institute, Visiting Nurses Association Health Group, and also Dr. Herb Conaway, who is a state assemblyman servicing Burlington County. And when we come right back, we'll continue our discussion about vaccinations and measles with someone who believes firmly that she and others should have the right to say no to vaccinations when Another Thing continues.